All right, if you're a runner, you know the feeling. That awful, nagging pain behind your kneecap that pops up a few miles into a run totally messes with your training and just will not go away, no matter how much you rest. We're going to dive into one of the biggest and most misunderstood reasons for this and why that go-to plan of just taking a week off, yeah, that might be exactly what's failing you.
I mean, does this sound painfully familiar? You feel that ache, so you do the right thing. You stop, you rest, you ice. It feels better. So you get all excited, you lace up, you head out the door feeling great, and then bam, like clockwork, mile 3 hits, and there it is again. It's an absolutely maddening cycle that can make you wonder if you're ever going to run pain-free again.
So that's the big question, right? Why does rest keep failing? If you're injured, rest is supposed to fix it, but with runner's knee, you feel like you're stuck in this horrible loop. Well, the answer is pretty simple, actually. Rest is only calming down the symptom, the inflammation, but it's totally ignoring the real reason the problem is happening in the first place.
Okay, so first things first, let's be super clear. Runner's knee can come from a whole bunch of things. Bad training habits, direct injury, IT band problems, you name it. But what we're going to zero in on here is one really common pattern that we see in so many distance runners. It's a breakdown in how your body works as a team, something we call the kinetic chain dysfunction pathway. Now, understanding this is a total game changer, but just remember, you always need a proper assessment to know for sure what's going on in your body.
So let's start right where it hurts, the knee itself. And to really get what's going on, I want you to picture something. Think of your knee as a train running on a set of tracks. This one little analogy, it's going to make everything else click into place. So here's how it works. Your kneecap, that's the train, and it's meant to glide perfectly right down the middle of a groove on your thigh bone, the femur. Those are the rails. When it's all working like it should, that movement is just silky smooth. But when that train gets pulled just a little bit off center, it starts grinding against the side of the rail. And that grinding, that is exactly where your pain and inflammation are coming from.
So what's pulling the train off the tracks? Well, you've got a tug-of-war going on. On the inside of your knee, there's a super important muscle called the VMO. Its whole job is to act like an anchor, pulling the kneecap inward to keep it centered. But on the outside, you've got these powerhouses, the vastus lateralis and the IT band, pulling it outward. In a happy knee, it's a balance fight. But with runner's knee, the outside team is usually winning by a landslide.
But why does that little VMO muscle lose the fight so easily? Well, it's because of something called reflex inhibition. See, as soon as your knee gets inflamed, your body's protective system can literally shut down the nerve signal going to that muscle. It's like someone unplugged its electrical outlet. So you can do a million quad exercises, but that one key muscle isn't even getting the message to turn on. And that's the vicious cycle. Pain shuts down the muscle, which makes the tracking worse, which causes even more pain.
But here's the plot twist. That weak VMO, it's not the real bad guy here. It's just a symptom. The real mastermind, the true source of your knee pain, is often hiding further up the chain. We've got to look at your hip.
Okay, look at how this chain reaction works. It all starts with weak hip muscles, especially that glute medius, that are supposed to keep your pelvis level. When they don't do their job, your hip drops, which forces your whole thigh bone to rotate inward. Now hang on, remember our train analogy? The thigh bone is the rails. So if the rails themselves are twisted and pointing in the wrong direction, there is literally no way for the train, your kneecap, to stay on track. The problem isn't the train, you see, it's that the track is moved.
All right, so we've looked upstream at the hip, but the problem is your knee is getting attacked from both sides. Let's head downstream now, because your ankle is a major accomplice in this whole kinetic crime.
You know, if you can't bend your ankle very well, what's called dorsiflexion, your body has to figure out a workaround just to move forward, and it usually does one of two things. It either forces your foot to turn way out, or it lets your knee collapse inward. Both of those are huge cheats, and both of them send all this weird twisting force and stress straight up the chain and right into your knee joint, making a bad situation a whole lot worse.
So we've got this messy, complex biomechanical puzzle. But now for the really cool part. What if I told you that a completely different system of medicine, using a completely different language, describes this exact same pattern? Let's build a bridge between the Western mechanical view and the Eastern energetic one. Think of this table as a Rosetta Stone for runner's knee. On one side, Western biomechanics says, hey, your VMO muscle isn't firing. On the other, Eastern medicine says, you have a spleen channel deficiency, because that channel runs right along the inside of your leg. Western science sees a tight IT band on the outside. Eastern medicine calls that an excess in the gallbladder channel, which runs down the side of your body.
Poor hip control? That's a kidney channel deficiency, the source of our deep foundational stability. It's two different maps describing the exact same territory.
And before you think this sounds a little too out there, let's be really clear. These channels aren't some mystical, invisible energy lines. They are, for all practical purposes, anatomical highways. They map directly onto the lines of fascia, the trigger points, and the motor points that modern science has spent decades identifying. That spleen channel, it runs right over the VMO's main motor point. The gallbladder channel perfectly traces the IT band. It's basically applied neuroscience, just guided by an ancient map.
So, when you put all of that together, you can see exactly why just resting the knee is totally doomed to fail. Rest doesn't fix your unstable hip. It doesn't fix your stiff ankle. It doesn't fix the tug-of-war happening between your muscles. You need a fix that looks at the whole system.
Real, lasting recovery happens in 3 stages. Stage 1, relieve, is just what it sounds like. We calm the angry knee down. But stage 2, restore, this is the secret sauce. This is where we retrain the right muscles to fire in the right order at the hip, the knee, and the ankle. This is the crucial stage that rest completely skips over. And if you skip this stage, you're pretty much guaranteed to end up right back at stage 1. Finally, stage 3, elevate, is where we make those new good habits strong and resilient enough to handle whatever you throw at them.
So, I want to leave you with this one question to chew on. After looking at everything, from the problems cascading down from your hip to the forces coming up from your ankle, is it possible that your knee isn't the culprit? Is it possible it's actually the victim here, just the noisy spot where all these other problems are showing up? Because the moment you start seeing your body as one interconnected system, that's the moment you can finally break the cycle and get back to running pain-free for good.